Hi guys, I'm Elaiza Eway from Group 2 N41. Today, I will discuss what is Spaulding classification of equipment decontamination. So, let's go! So, what is Spaulding classification? So, Spaulding classification, according to CDC, it is a strategy for sterilization or disinfection of inanimate object and surface based on the degree of risk involved in their use. So, it is proposed in 1957 by a microbiologist named Earl Spaulding. And Spaulding classification, there are three categories. The first category is critical, or also known as a high. The second category is semi-critical, or also known as intermediate. And the last category is non-critical or low category. So for the first category, let's talk about critical or high category. It is medical devices involved with a break in the skin or mucous membrane or entering a sterile body cavity. So for the level of microbicidal action, it kills all microorganisms. For method of decontamination, cleaning followed by sterilization, usually heat if heat stable or chemical if heat sensitive. So these are the example of common items or equipment for critical or high category. The first is surgical instrument. Next is implant, biopsy instrument, foot care equipment, eye and dental equipment, and last is cardiac and urinary catheters. So let's discuss the next category, which is the semi-critical or intermediate category. So semi-critical or intermediate category, it is a medical devices in contact with mucous membrane or non-intact skin. It kills all microorganisms except high numbers of bacterial spores. It is cleaning followed by high-level disinfection by heat or chemicals that under controlled conditions with minimum toxicity for humans. And also, it is sterilization preferred. So these are the example of common items or equipment for semi-critical or intermediate category. First one is the respiratory therapy equipment. The next one is the anesthesia equipment, tonometer, cystoscopes, laryngoscope blades, and the last one is the anorectal manometry catheters rather. And for the last category, which is the non-critical or low category, it is items in contact with intact skin. It kills vegetative bacteria like fungi and lipid viruses. Cleaning followed by low-level disinfection in non-critical category. In some cases, cleaning alone is acceptable. So these are the common items or equipment for non-critical category. The first one is the ECG machine, oximeters, stethoscope, bedpans, urinals, commodes, And the last one is the crutches. Methods of decontamination. There are two types of methods of decontamination. The first one is the chemical decontamination. The second one is the physical decontamination. So let's tackle first the chemical decontamination. Chemical decontamination is the leverages chemical disinfectant and sterilant to eliminate pathogens. The physical decontamination it involves processes like heat radiations or filtration to remove contaminants. So let's discuss what is the chemical decontamination. Under sa chemical decontamination, na-portray two types, which is the liquid disinfectant and the gaseous disinfectant. Ang liquid disinfectant, it is effective against a wide range of microorganisms. While the gaseous disinfectant, it is utilize gases to eliminate pathogens. It is suitable for heat-sensitive equipment. So for physical decontamination, there are three types of physical decontamination. The first one is the heat sterilization, the second one is the radiation, and the last one is the filtration. So let's tackle what is heat sterilization. Heat sterilization, it is utilize steam or dry heat to kill microorganisms, often accomplished through autoclaving. And for radiation, it is UV or ionizing radiation effectively destroys DNA in pathogens. And for filtration, it is removes particles from air and liquids, often used in clean rooms and laboratories. Conclusion: maintaining patients' health and safety requires an awareness of the Spaulding categorization system. When you know exactly how to set up any equipment for the next patient, you may contribute to ensuring their safety from infections linked to healthcare. So, any question, everyone? Violent reactions. Nakasabot ra ba ang tanan? And I hope na nakasabot mo sa akong gidiscuss. So, thank you, everyone. Thank you for listening and thank you for watching. Again, this is Elaiza Eway from Group 2 N41. So, thank you guys. Have a good day. Bye!